most famous physical therapist on the internet.
Hi, Brad Heineck, physical therapist.
Hi, I'm Chris the Pharmacist.
And today we're going to talk about Losartan for high blood pressure. What are the side effects and the risks that you need to know? Chris is going to go through this in detail. It's going to answer all your questions. But before we go any farther, we have a little business to take care of.
All right.
And if you're new to Bob and Brad, or if you're not, you know this, bobandbrad.com. Go to there for the giveaway. We have an incredible giveaway today. We got 6 exercise strengthening products with our name on them. We love them. Or you can go to Facebook. It's pinned to the top of the page. Or if you want the 60-second version, you can go to Twitter, Instagram, or to the infamous TikTok. Anyways, let's get rid of this.
All right.
What are the giveaway? So if you sign up for the giveaway, you can win all of these in one package. We have the grip strengthener, which not we, but we had a rock climber invent this. It's a great way to strengthen your grip.
That thing.
Look at this. This whole box comes with 5 straps like this with nice red handles. We got our name on those as well. We use those on a regular basis. We love them. And we just started using the 6 or the large loop. Have you used loops yet?
I have not.
But I have a feeling you're going to get into them.
Actually, I'm going to buy some because I like
And
it.
your son, he's a hockey player. It's going to be real beneficial for him. They all come in a nice box like this. And this is the loop that goes around the waist for hip abduction workout. Much, much better than the typical latex one. Much more comfortable. Works great. And
Your
the
favorite.
suspension straps. This is one of my newest and more favorite workout devices. Everything I do fits right on my wall. I can get an incredible workout. But let's get on with Losartan.
All right.
Chris, have a seat.
All right.
So I'm going to pretend that I just came from the doctor. The doctor said you got high blood pressure, hypertension, and I'm already like, oh no. And he says, I got to take this medication. And he went through some of the rigmarole on how to take it. But I was so kind of nervous about it, I kind of forgot. I'm going to go to the pharmacist and figure out if I can get this squared out and feel more comfortable about it. Now, I didn't know this until a few years ago. Chris is a pharmacist. I've known him for years, but I actually went to where he distributes his medications, and he does an outstanding job on making his customers feel like they're knowledgeable about the product, the medication they're going to take. And so that's the approach we're going to take. So, Chris, can you talk a little bit about how people come, let's say they're come for Losartan,
I sure can.
and they're a little nervous sometimes, or they're mad, or what is this?
I think there's a lot of emotions. I mean, anytime somebody tells you that something's wrong with you, I think we somehow naturally kind of get a defensive mechanism.
Sure.
Like, oh my gosh, this is awful. And I think a lot of times when you're not feeling well, or in the case like Losartan is a medication for blood pressure, but it can be also used for a couple other things. But I mean, we'll just, for simplicity.
Is Losartan the name of it, or is that a generic name?
Nope, generic name is Losartan, brand name is Cozar. It's the first angiotensin receptor blocker that was out on the market, ARB for short.
So what does that mean?
That's how it works. It's just all these drugs have their own little categories.
Sure.
And so they can have, calcium channel blockers.
So does that work with the heart directly, or does it
Actually,
work with...
indirectly, it's going to work on the blood vessels itself.
Okay.
So, if you were to come up and you, hi, Brad, this is your prescription for Losartan today.
Yeah.
It looks like it's going to be a 50 milligram tablet daily. Did your doctor spend a little time talking to you about the medication?
Yeah, but I can't remember anything you said.
No, and you probably went through a lot, and it's a lot to hear and a lot to process. So why your doctor chose this, he didn't like how he saw your blood pressure developing. So he thought it was probably a little elevated in all likelihood. Does that sound like something you guys may have talked about?
Yeah, and he said something about it maybe would raise my risk for a stroke or something like that, which is pretty scary.
Well, actually, it's going to help to prevent strokes. So by lowering the blood pressure.
Okay, but a high blood pressure.
High blood pressure can increase your risk for a stroke.
Okay.
So, So by lowering it, so basically it relaxes, what it does in your body is it's just going to relax the vessels in your heart and all around the heart, so the heart doesn't have to work so hard.
So you say vessels, you mean like
Your
arteries?
Arteries, arterioles.
So they relax and they get bigger?
Yeah, they have little receptors. And so if you think of it as a hose, so when things
Garden hose?
Garden hose. So, and so when it's wide open, water is flowing right through that garden hose.
Yeah.
When it gets cramped down, it comes through a lot harder, but there's a lot more resistance to squeeze that water through that tiny hole.
So the pressure goes up?
Yeah, so if you think of your heart as the pump, it has to work a lot harder to get that water through, well, in this case, your blood through your body.
So it just relaxes the vessels, allows the blood to flow through more easily with less pressure involved. So then the blood pressure goes
Heart's
up.
not working so hard,
right.
man. So it works
So
out
that's
pretty
not so
slick.
bad. So I just take it
One a
twice
day. Well, no, your doctor's got you taking this once a day.
Yeah.
And actually, the newer studies actually showing, that came about it last year, it might be better to take blood pressure medication, most blood pressure medications at bedtime. Diuretics got to take in the morning. That's a different discussion. But we'll talk about, for this one, probably going to do better at night. Actually, maybe a 50% reduction in heart attack and stroke if you're taking your blood pressure at the same time every day at night. So the big thing to make any medication work well is to take it consistently. So it's important for you to take it at the same time every day or within a small window. So if you're taking it at bedtime, just take it approximately the same time every day. That's critical for you.
Okay. Do I need to take it with food?
This one doesn't matter, which is good. So
just water?
Yeah, big glass of water. So like 8 ounces of water, well, 6 to 8 ounces of water. Some people don't like to drink a lot before bed, but you do want to be hydrated.
What if I, football game or whatever, I'm going to have a beer?
No, well, the one thing that's kind of interesting, that's a good point that you bring up. I mean, being from Wisconsin, there's a lot of people that do probably enjoy
Sunday night
beer.
football before you go to bed.
Exactly. And so
Packers.
So blood pressure, when you have a beer or a glass of wine, it is going to naturally bring your blood pressure down. So you could get lightheaded or dizzy, which kind of leads us into some of the side effects with Losartan. So drinking alcohol.
I get lightheaded or dizzy from the alcohol?
The alcohol and the drug. It's the combination of the two together. Your blood pressure's here and it can bring it down even further. So let's say you're sitting down watching the game, you took your medication because you got an hour to go, and then you stood up too quick.
Yeah.
All of a sudden you get really lightheaded or dizzy. That's called orthostasis, and it's a fancy term that just says you're dizzy.
Sure.
But some people it can be so severe you could hit your head on the coffee table, and
so you get so dizzy you fall.
Yes.
Right.
So you want to be real careful with that. And as we age, sometimes our muscles don't work as well as one another. And this is probably a lot more in detail what I would give to a patient, but it's something to be aware of. We don't want you to take a tumble because you could get hurt.
Right.
So we have to be careful with that. And actually, so the first 5 days while you're on drugs like Losartan, it takes your body about that long to start to begin to see that blood pressure lowering. And then it takes about 3 to 6 weeks for that maximal response to occur.
Okay.
So you might have to go back and see your doctor to see how things are going, and maybe they'll adjust as necessary.
So I've got a lot of things going on here, how to take it. I feel a little bit better about it now, but there's some things, the side effects. What I've heard, there's some side effects that may not be good for this.
Yeah, and it's kind of crazy. I mean, all drugs have a ton of side effects, and if we
you're not making me feel good, Chris.
I know. So basically, we want to focus on the major three. Most side effects in general from all medications, very, very uncommon across the board. Now, everybody's going to have a story of, well, my uncle took this and it was horrible. I mean, it can happen. We have genetic predispositions towards certain drugs. Our race can dictate what drug is actually better for us versus others. So
we need to really depend on our doctor. He has made the...
Your doctor did the homework. Your doctor prescribed this for a very specific reason.
Okay.
And unfortunately, anytime we get a new prescription, we're all lab rats. You don't know what that first dose is going to do until you try it. And sometimes it takes our bodies a few days to get used to it.
Sure.
So we want to be real mindful of that. So in the case of the blood pressure medication, like I said, it takes about 5 days to start to kick in, 3 to 6 weeks for that maximal response. What we're going to see is your blood pressure's here, and it's going to gradually come down. It's not going to come down like you're coming off a cliff.
Sure.
If it did that, you could have some pretty serious problems, and that orthostasis we mentioned earlier could be.
But you're gonna feel some symptoms,
you would. And
lightheaded, dizziness.
So lightheaded and dizziness are the primary things that we always warn people about. So how do you prevent that? Well, when you get out of bed in the morning, don't just jump out of bed and walk across the room. Just sit up slowly. That's one thing that I find very important. Let's say you went to tie your shoes and you just popped right back up. Stand up slowly for the first couple of days. Your body will naturally adjust, but after about the first 5 days, you just take a little bit easy then.
Sure.
After that, the side effects really become inconsequential with this drug. I mean, the one thing that we want to watch for, and if this is the only drug you're on, it's not going to be a big issue, but sometimes people that have blood pressure issues may take multiple medications. This is a drug that is known to raise our potassium levels. And potassium, this is going to be a sidebar here. But for the most part, we have to make sure that we're not eating more potassium than we should. A normal healthy diet where you're having some bananas, cantaloupe, potatoes, broccoli, those types of things are certainly fine. You just don't want to
Those are foods that are high in potassium.
High in potassium,
okay.
Oranges, orange juice, those types of things. So you don't want to have tons of it, but I still think it's important to have a wide variety of food in your diet. So when you heard me say diet's very, very important when people have blood pressure issues. I mean, one of the coolest things that most patients aren't aware of when they hear the bad news that they have hypertension, we can get you off these medications with lifestyle changes in a lot of cases. So if you're willing to put the work in and exercise, and you're willing to put the work in and eat a healthy, balanced diet, and you're willing to get some good rest and hydrate well, we may be able to naturally, with the weight loss that you can create, you may actually get off of the blood pressure medication. It only can be like 10 pounds.
Oh.
Might be enough depending upon where that level is. Genetic factors withstanding. So again, your doctor would probably tell you this, but again, it's pretty overwhelming to hear something like you have hypertension. I mean,
Sure.
do you think you're going to have a stroke? Do you think you're going to have a heart attack? Do you think you're going to die? It can be a terrifying experience for a lot of patients.
So the biggest side effect I have to worry about is monitor that I'm not getting lightheaded or dizzy. And if that's not happening, I trust my doctor. He gave me the right one in combination with the other medications
Yep.
I'm taking. Also, now the pharmacist, you will be aware of the other medications that patient is
Yeah,
taking.
we're going to be looking
so
at
you
that
double check
exclusively.
it.
Yeah, we are anal retentive to a fault. I mean, we're going to sit there and look at that profile and make sure that there's nothing cross-reactivity type-wise, because people could come in for Losartan, and there could be another drug called like an ACE inhibitor like lisinopril. This is a total sidebar again,
Yeah.
but we see, why are you getting this today? Oh, I got a cough. What's a primary side effect of that drug? Well,
Sure.
discontinue that and we'll start this, because too much together, all that potassium problem could be an issue, lightheaded dizziness. There's a lot of things that
So
could go
between
on
the
there.
physician and the pharmacist, you guys double check each other to make sure
there's
you're
phone calls,
there's side
faxing,
yeah.
emails. We communicate pretty readily with the nurse staff. Usually we end up with the nurse staff.
Sure.
And we'll double check with the doctor and they really get back to
Yeah.
us. But we're looking for those things very
Sure.
hard. Actually,
Yeah.
it's 90% of my job.
Sure. Well, I feel a lot better, so I can take it. I know the side effects, and if I want to take the effort and change my diet, my exercise, and my liquid intake, water, you're saying I can get rid of these.
It's very possible, very possible. So
Sure.
you got to put the work in, and it might take a little bit of time. But working with your doctor and
Yeah.
knowing that you've got a plan to work ahead, I mean, you can live a healthier lifestyle. But I will point out, all drugs do have side effects. Even the positive effects of the drug are a side effect. We just learned that was the good part of it.
Sure.
So if something bad happens, or let's say you're losing consciousness, you're really
Ooh.
dizzy, you don't feel right, you're nauseous, just think your heart's racing, just some things. I mean, when we take many different medications, if it's weird, reach out to your pharmacist, reach out to your doctor right away.
Sure.
Because if you don't feel right, it could be a possibility that there's something going on. And the other thing we didn't touch on, if you're pregnant or thinking about being pregnant, Losartan is not a good drug for you.
Oh, that's good
So
to
it's
know.
teratogenic, which
Well,
means
not
it
for me
causes,
personally.
not for you personally, but we'll say Liz. But anybody that is childbearing age, it's important to have probably a backup plan if we're trying to avoid pregnancy. Or, maybe we have to try and find a different medication if that's
Sure.
the family planning's
Sure.
in the future.
Okay, well, good. And boy, this is I feel a lot better about it now, Chris.
All right.
And hopefully that's the same experience you'll feel after you see your doctor, your pharmacist. And I didn't realize it, but that is one of the jobs of the pharmacist, is to help you understand what you're taking.
Yep, that's what we hope to do for everybody.
That's right. Very good. Can you do anything for a broken heart, Chris?
I can fix a lot of different things, but I can't fix a broken heart. I'm sorry.
Well, then you're not going to be able to help Bob and I on that quest. But anyways, carry on.
Have a great day, guys.